This is a KX News special report.
Good afternoon. I want to start out today with an update on global situation, then bring it back to North Dakota. The coronavirus global pandemic continues to accelerate even in countries that we would consider to have healthcare capabilities similar to the United States. We've talked about Italy at past conferences, but I want to mention Spain. Spain is now in a position where it's likely going to pass. Italy is having the second most number of coronavirus cases, and this is in a country that has only about 50 million people. There are now 27,000 people hospitalized as of today in Spain, putting severe strain on their system. 3,600 people are dead. Over half of those, 1,825, are in the metro area of Madrid. And death toll in Italy is now topped 7,500. I start with these sobering figures because it's easy when we're blessed to be here in the geography of the upper Great Plains in a great state like North Dakota with very few counts, and so far the blessings of no one having passed from this novel, new and deadly disease. It's easy for us to perhaps get complacent, but we want to start with that because have people understand that this virus is non-discriminatory, and perhaps this will help us understand in terms of humanity that we're all more alike than we are different, that we've all, regardless of country or political system, race, creed, or religion, this virus has the ability to attach itself and create health issues, including death for humans. And so maybe in our lifetimes we've never been in a position where something has come up where we understand that we're literally all in this together. And it's important for us as North Dakotans to understand that we have always viewed ourselves, and probably appropriately, that this is a special place to live and work and raise a family. And we have special characteristics and special capabilities and a special culture. We're not special when it comes to an immunity to this deadly virus, and so we have to make sure that we continue to understand that we are just beginning down a path where other states and other countries have already journeyed. And I get asked frequently what kind of data are you using to make decisions, and part of the data we're using is watching the progression of this disease occur in other developed countries, and understanding that, well, China was able to almost in some ways put a glass jar over the 50 million people that lived in the Hubei area. We don't have those kinds of controls here in the U.S., and so what they were able to accomplish in 10 weeks may not be possible. Certainly not possible in a land where it's not possible to shut down movement in the same way they did when, again, we're relying on the goodwill and the individual responsibility of citizens. But having said that, as a sort of sobering beginning that we're still at the very beginning parts of this, let me just give you an update on the numbers out of North Dakota. Today, the North Dakota Department of Health confirmed 9 additional cases of the novel coronavirus disease, or COVID-19. First was a man in his 50s from Foster County. Second was a man in his 60s from Ramsey. Third, male in his 30s from Morton. Fourth was a male in his 50s from Cass County. Fifth was a male in the 50s from Cass County. That one is possibly travel. Woman, female in her 50s from Cass County. The ones that I named so far that were not travel or still under investigation. The next 3, again, which we view as important because the contact tracing has been completed. We're not able to identify contact through either another known positive or through travel, but we have a female in their 70s from Ramsey County, a woman in her 30s from Stark, a woman in her 60s from Stark. All three of those last ones are attributed to community spread. So with the addition of Foster and Stark, we're now up to 10 counties on the map with confirmed COVID-19 cases, but there has been some question. After we announced a case in Dunn yesterday, there was a lot of activity on social media that was describing that an individual from one of those counties might have had a physical address there, but it was an individual who was actually living in Cass County but still had an address. We, of course, don't have access to that kind of information, so helpful that families or others that might have specific information about personal living areas may want to share that. That's great because they're getting the word out to their communities. But you know, from a standpoint of maintaining the Health Information Privacy Act or the HIPAA laws, we're going to only be releasing county based on the address of which the person submitted that address when they applied for the test. So there may be some variances between when we name a county and where the person is actually living, but I was happy to at least see from the family that that one individual who's in Cass County is in isolation and has been that way since return from international travel and is recovering. So that's good news. Totals. North Dakota, we've got 1,955 tested, so closing in on 2,000. That's a plus 353 individuals from yesterday. We like the trend line because we want to see the number of tested continue to climb. But of course, nine positive, including that brings us to the total of 45 individuals. In terms of hospitalizations, we're a +1, so up to 8 that are hospitalized from this disease. And of course, that means a question yesterday, none of the people that were previously hospitalized have been released. So again, we want to make sure that everybody is keeping those individuals in their thoughts and prayers. We now have received tests from 50 of the 53 counties. I think that leaves Slope, Billings, and Dickey as 3 counties that we at least don't have a test that's got an address from one of those 3 counties, but closing in on statewide testing. The good news on testing, as we've continued to work the supply chain on this side, we do have 1,155 test kits at the North Dakota Department of Health that are ready to be able to be sent out to facilities around the state. So if anybody's running short of test kits, contact our Department of Health. And we do have the supplies on hand at the lab for the ability to run 3,248 tests. And of course, we're trying to replenish that, but we at least have the ability to more than double the number of tests that we've taken in the coming days if that many tests are recommended by health providers. In addition to that, knowing that we want to move from testing people in the thousands to testing tens of thousands of people in our state, one of the ways that we're going to be able to, in a more targeted way, make sure that we're creating the quarantine for people that are positive and those people who've been in contact with positive cases. That's the way we can really slow the spread versus trying to get a whole state of which the majority of the people in the state at this moment are still healthy. You know, again, we can be more targeted and less blanket if we do more testing, and that is since we know that we're going to be in this for weeks to come, that we need to make sure that we're continuing to do everything we can to ramp up that testing. So we do have a task force that is assembling itself. So in addition to the great work that's already been done by our North Dakota State Lab, the small team there that continues to churn out these tests and work around the clock, we're also enlisting help from the private sector. And pleased to announce that Ross Manson, who's an executive at Eide Bailly, one of the senior partners there, and has earlier in his career led the healthcare practice, consulting practice at Eide Bailly. He and a team of other consultants from their group are going to be assisting the work that we're doing out of the Unified Command. And again, Unified Command being led by our State Health Officer, Mylyn Tufte, and Major General Alan Dorman, who leads emergency services for North Dakota. Part of what we're going to look at is not just our own capabilities, but also the capabilities of our university system, because it's possible that we'll be able to convert some testing capabilities at UND, NDSU, or the University of North Dakota School of Medicine. In addition, I've been in contact again today with executives and the CEO, Michael Chambers, and one of the co-founders of Aldevron. We're fortunate to have in our state one of the top biotech firms in the world. Aldevron is certainly what you'd call critical infrastructure. They are working on providing testing materials to pharmacy companies around the world, as those pharmaceutical companies around the world work to be able to create vaccines. So we want to make sure that Aldevron continues to do that important work, and they're doing that here in North Dakota, and could very well, they and their customers could be part of that global solution. But they are going to work with us, the executives from Aldevron, to see if they can also jump in and help us be part of this testing task force, to see if we've got the equipment and the personnel to broaden out our ability. A vision for North Dakota would be that we could become one of the states that actually leads the way on the testing side, because this is something that we look to other countries, in particular South Korea did a fantastic job on testing, and at least so far in the U.S. We're not where we need to be as a country, and there's a chance here for North Dakota to lead. The summary of all of this is the most important messages for people to really stay vigilant in terms of the requirements, and not become complacent about the guidance that we've been giving, whether that's washing hands, staying at home, avoiding other people when you're sick, make sure that you're not either hosting or attending gatherings of more than 10 people. If you do get together with 10 people, keep your distance, as everybody here in this room is doing so well. Those are some of the basic ways that we can stop and slow down the spread. And I've flipped to the strategy again of why we're doing this. Why are we taking the steps to slow down the spread? As we've shared before, and you've heard in all the national news about flattening the curve, on the slide that's up behind me and possibly online, we've got sort of two curves. One is if you sort of do nothing, which is we have normal levels of human interaction, you've got rapid spread of a virus, and you get a lot of cases quickly, and when you do that, it dramatically stresses our healthcare system. We know now that there's, again, other studies that are showing that if you've got access to trained critical care nurses, intensive care, ICU as it's often called, intensive care unit. If you've got that kind of capability with a ventilator, you could have as much as a 10-fold increase in survivability, or a 1/10 less a chance that you're going to die if you have the proper care. What has happened in places like you're seeing in Spain and what happened in Italy is literally the cases pile up and come so quickly, that steep curve, that you end up with patients in the hallways of hospitals, as opposed to actually in an intensive care unit with the appropriate care and with ventilation, et cetera. So we're trying to flatten that curve out. But as we flatten that curve out, on that curve, the other thing that we're trying to do, there's a line on that slide, which you should take a look at, which represents healthcare capacity. That is that blue line that cuts across, and then you see this area in the blue curve underneath the line is the curve that we're trying to achieve. We want to have a gap between the number of cases and our healthcare capacity. But one of the things that we're doing from a government standpoint is working very closely with the private sector, and now we have a full team assembled. We're very pleased to announce that Greg Wills, who led emergency services for the state of North Dakota, retired 2 years ago, has come back out out of retirement. He's joined our team at the Unified Command, and he started digging in 2 days ago on the hospital capacity task force, and we're doing everything we can to identify how do we raise that line even higher, and that may include, as we've talked about earlier, conversions of buildings or wings that used to be used for patient care that are no longer, that have currently been sidelined, but how quickly could we bring those back on? We've been in contact with the Army Corps of Engineers and their mission about building emergency field hospitals. And so the goal that we have is to take the number of beds that we have in North Dakota, increase the percentage of those that would be able to handle an ICU situation, and then possibly even create even more beds beyond that. So we call the surge capacity, and we've identified that into 3 tiers, and at future press briefings we'll have more updates on that. But I wanted to make sure that everybody that's listening can do their part to help flatten the curve, because that's about personal responsibility, and you know, we're holding all of our guidance that we've had in prior that we've given in place, and asking people to continue to do a great job on keeping physical distance and practicing the good practice to slow the spread, but also want everybody to know that we're working around the clock to raise that line, so that if we need that extra capacity, that we'll be ready to do that. And again, why does this all matter? As you saw today, we were, you know, +9 on new cases, so numbers are still climbing. And the more testing we do, the more positives we'll find. As we've said, every single meeting, the testing is latent data. And so I'm giving you a number today, which is our test from today, but that probably, you know, there's probably 2, 3, 4, 5 days behind. We also know that there are still a number of tests that are pending, that haven't come back, that are in the queue. And so we have every reason to believe that the numbers are going to continue to climb, and that we could be weeks away from seeing the peak here in North Dakota. And as we keep that physical distance, again, we like to remind everybody that doesn't mean that there isn't an opportunity to still reach out and support your neighbors and friends in any way that you might be able to do that, if you can do that from a distance. So next up, I want to talk about a executive order. Possible I'm missing a page here, but we'll, nope, got it. Okay, executive order for today. Wouldn't be Wednesday if we hadn't signed another executive order. This one is a good one. Executive order provides workers' compensation for first responders and healthcare providers who contract COVID-19 on the job. The environment of someone who's working as a first responder significantly increases their direct exposure to COVID-19 as they're working to help others and save others' lives. Currently, North Dakota's workers' comp law does not cover viruses. Doesn't cover viruses such as COVID-19. The law isn't structured to provide benefits for first responders or healthcare providers who, if they contract that disease, then would be instructed to quarantine themselves away from work, or as we say, get sidelined. And sometimes these people might even get sidelined because if they've had contact, they're awaiting test results, they may be asked by their employer to stay home. And so we understand that's the right practice, but that can hurt people financially. So it's imperative today under these extraordinary circumstances that we extend coverage to our frontline personnel. So this executive order provides coverage for first responders who contracted on the job. It also provides up to 14 days of medical and wage replacement benefits for first responders and healthcare providers who are quarantined. The quarantine benefits, they're time limited, subject to quarantine imposed by a medical or public health official because of a work-related exposure, or those who have lost wages as a result of a quarantine and are not eligible for compensation for lost wages from another source. And if the virus is contracted on the job, the employee becomes eligible for full workers' comp benefits just like any other compensable work injury claim. The scope of this order is broad. It's intended to cover firefighters and law enforcement and ambulance service providers, including our volunteer rural ambulance providers, medical service providers, volunteer first responders, all those that are critical in the fight against COVID-19. And again, well, most workers' comp carriers are providing coverage for healthcare providers during this pandemic. The state of North Dakota is going above and beyond to take care of its workers by providing this coverage, not only to the healthcare providers, but again, the firefighters, law enforcement, and volunteers. If you think this is a small group, let's just take a look at the numbers in North Dakota. It represents more than 10% of our state. Paid medical providers, there's 64,000 of those in the state of North Dakota. Paid firefighters, you'd find these mostly in our major cities, 11,001. Volunteer fire department, the backbone of most of our small and rural communities, 7,714 individuals that work in volunteer fire departments. Paid law enforcement, and that would include not only police but also sheriff's deputies and others. Paid law enforcement, 5,907. The volunteer ambulance folks that do such important work, 873 in volunteer ambulance. The total of all those, I'm sure you have that already, is 79,641. Coverage is available, backdated to March 13th, the date that a state emergency was declared. To apply for benefits, again, if someone contracts COVID on the job working in any of these fields or is asked to be quarantined and is missing work, you can file for your claim at Workforce Safety Insurance, North Dakota's very own workforce insurance company, and you can do that at workforcesafety.com. Some other quick updates. Another update is just in terms of making sure that we're staying in connection with all of our neighbors, with which again, the virus doesn't recognize the political boundaries, whether those are state or national boundaries. So have now completed the circle after talking to Governor Kristi Noem from South Dakota and Governor Bullock on the days prior to that. Today had a great conversation with Governor Walz from Minnesota, and also talked to Saskatchewan Premier Scott Moe. In Saskatchewan, again, like Manitoba, like reported yesterday, they're doing a great job up there. A lot of testing that's gone on in Saskatchewan, and I think over 6,000 tests for 1.2 million people. So they're doing some really good things up there. And so again, when our neighbors are doing great work, that helps protect us. And then Governor Walz, again, we take a look at Minnesota, where they've got 5.7 million people. They've done 11,500 tests, 287 positives. People might say, oh, this is worse in Minnesota than it is in North Dakota. On a number of cases per testing, we're at about the same rate as Minnesota. So someone shouldn't assume that things are a lot better in North Dakota than they are in Minnesota, because again, that begins to sense a false comfort when our testing numbers aren't as large as others might be. So anyway, we'll continue to stay in touch with our neighbors. I think in particular it's important for Minnesota, as we do our hospital surge planning, when we take a look at our major providers on the eastern part of the state, whether that's Essentia and Sanford and Fargo, all true in Grand Forks, or the hospital down in Breckenridge, Minnesota, which serves Wahpeton. We've got these border facilities that in the case of doing our planning, we can't just plan for North Dakota, because perhaps as many as 1/3 of the patients in regular operations in Fargo or in Cass County and in Grand Forks might be coming from Minnesota. So part of the conversation with Governor Walz is understanding that we've got when we're talking about making sure we have the right supplies for our hospitals, then Minnesota may need to be supporting North Dakota facilities, because we're serving Minnesota systems, and that could be a good thing, because of course based in Minnesota are companies like 3M who manufacture masks, and the Mayo Clinic who has the capacity to do 4,000 tests a day but isn't up to that limit yet. So again, there still could be opportunities for more collaboration during this battle with both the private sector and with Minnesota. Next topic, PPE is maybe an acronym which we're all starting to learn and understand, which is the personal protective equipment. Private sector nonprofits are taking steps to help our frontline workers, help increase the supply of certified N95 masks and other PPE equipment for North Dakota hospitals and the workers within them. This weekend, North Dakota AFL-CIO, in partnership with the Minnesota Nurses Association, North Dakota Building Trades Union, West Area Labor Council, Red River Valley, Northern Plains United Labor Council, the AFL-CIO, and Red River Building Trades, they'll be hosting a personal protective equipment donation drive at labor halls in both Bismarck and Fargo. Unions, these locations will be accepting donations of new N95 masks and protective equipment, new as in unused. They don't have to be new if you've had them in inventory. Still happy to have them. This drive will take place 12 to 3 p.m. on Saturday in Fargo-Moorhead at the FM Labor Temple at 3002 First Avenue, and 12 to 2 Saturday and Sunday at the Bismarck Labor Temple at 1323 East Front Avenue in Bismarck. And if you come, remain in your car. Staff will accept masks and equipment. Specifically, they're looking for these masks for either healthcare or construction uses, new and unused Tyvek and hazmat suits, safety goggles, latex-free gloves, electric respirators, or powered air purifying respirators. So thank you in advance to anyone who might contribute to this important cause. And then as a side note, again, one of the other things we're exploring, trying to make sure we've got equipment in North Dakota, is Rough Rider Industries is looking if they can secure the materials, whether or not they could go into production of N95 masks. Two more topics. Next one, unemployment count. As of through yesterday, 1,865 claims on Tuesday. Wednesday, as of 3 p.m., 893. That brings the total to 11,700 unemployment claims in North Dakota in the last week, and that's a record. We've been getting a lot of questions about that. We'll put up on the screen here the who to call, but again, jobsnd.com or 800-777-5033 if you've got questions about unemployment claims. And the next topic, emergency Medicaid waiver. This is another good one. North Dakota was one of the first states approved by the federal government to have more flexibilities in its Medicaid program due to the COVID-19 emergency. This is a Section 1135 emergency waiver, allows Medicaid to streamline enrollment to providers, reduce provider burden associated with getting prior approval for services, and allows nursing homes to have longer time periods to meet screening requirements. These flexibilities are the first step in a series of moves that will enable Medicaid to meet member and provider needs quickly. Our North Dakota Medicaid team has worked quickly with CMS, that's the federal agency, to gain this approval. The waiver became effective 5 p.m. Central Time, March 15th, 2020, with a retroactive date all the way back to March 1st, so that's good news. If you've got questions, call our Medicaid team and Human Services. And that brings us to the end of our formal remarks, and I'm going to close with just a comment on gratitude before we go to questions. I think one thing in reflection, as we have had lots of reports of people coming up short of supplies or empty shelves, or and we joked here about toilet paper at prior meetings, but I think one thing we need to understand as we go through this time, just as perhaps our grandparents or great-grandparents went through the Great Depression, as a generation went through World War II, as other points in the history of our country, and the year 2020 is a year that anyone of any age will remember, because it'll be the year of the global pandemic. Younger people might remember 9/11 as a date that really sticks out as a singular date in their mind and memory. But we're not we're living through history right now, and we're living through a year that is one that they'll be teaching people about, decades or a century from now, just like people are talking about the Great Depression. They'll be talking about the 2020, the year of the global pandemic. And one of the things that may get written is that, that wow, there was, short-term disruptions in supply chain, or people move that supply chain, out of a warehouse and into a grocery store shelf, and the supply chain, the inventory didn't disappear, it just got moved to individual homes. And so that there may not actually be scarcity, because I don't think anybody's consumption of these products increased. It's just it got moved around. And so it visually looks to us as if there's scarcity. And then when we see pictures of scarcity, we think we're living in a time of scarcity, when in fact, we continue to live in a great time of abundance. And I think one of the things that we have to remember every day as North Dakotans, that every day you have an opportunity to wake up grateful, to wake up in gratitude. And because all of us, even though if you think you might be short of a product for a day or two, there is no limits to the amount of kindness that we can show to other people. There's no limit to the amount of gratitude we can give to other people. There's no limit to the amount of patience that we can provide to other people. And there certainly is no limit on the amount of love that we can share for people that are actually suffering through this, whether it's loss of a job, or an entrepreneur whose business has had to close and they've spent years building it, or someone's got a family member that is ill, that is do that. So we have abundance of all these things, and we have an opportunity when we're faced with what I'm sure is rising anxiety, increases in needs for behavioral health at a time when there's stresses on our medical system. We got to remember that each of us have an opportunity to play in this thing, and we can play with, and we can play and participate and support family members and neighbors and coworkers in ways where we have an opportunity, because sort of, as you say, next to every one of us, there's buckets of kindness and gratitude and love and patience sitting around us, and you can just reach in there and pull some out, and when you turn around and look at that bucket, it's refilled. It never runs out. And so we need to keep focusing on through all of this, because it'll not just be how we get through this logistically, but how we get through this emotionally and spiritually. And I would like to think that on that list, North Dakota will be at the top. So with that, we'll go to questions.
You had a talk with Governor Walz. Two parts. One, did he let you know that he was going to go with shelter in place? And number two, did he ask you to consider shelter in place?
Question from radio legend Dave Thompson from Prairie Public is, when the conversation with Governor Walz, did he inform us about his shelter in place, and did he ask us to do the same? And the quick answer to both of those is no and no. Our good intel that we have, we had indications earlier in today that he was going to make that announcement. It did not come from him, but we got good feelers out. We had heard that, but I didn't think it was appropriate to ask him. That's his call, and he did not ask us to change what we're doing. I think, again, one of the beauty of our country is that you've got 50 governors, and each state's in their own unique situation. And even though we share health systems and share borders, we can each approach it differently. I think that one of the things that was clear was he's trying to do, I think he feels that what they've put in place has reduced contact by about 50%, and he's trying to get it up to an 80% reduction in contact through additional stay-at-home orders. North Dakota, we don't need more stay-at-home orders. We don't need more government intervention. We need, more individual responsibility for people, keeping distance, because it's not about staying at home, because you could be out and about as long as you're keeping physical distance from people. And there's a lot of places to do that. We got 71,000 square miles in our state, and we've got some of the lowest population per square mile of anywhere in the world. There's a lot of ways where you can not just be 6 feet away from someone in North Dakota, you can be a mile away from them. And so I'm not going to order people to stay at home when they got miles they can go in any direction without even running into a neighbor. So we are, but we have to, if we exhibit the individual responsibility piece, then, we should have a goal. We have a goal of, like Minnesota does, of reducing that contact. because if we reduce contact, we reduce spread, and that takes pressure off the medical system. I think in the model that they're using, he thought it bought him another 18 days from the time frame. They could move the peak demand back another 18 days, and that time they could build more emergency hospital capability, and as we said, maybe keep a gap between the two curves. And we want to do the same thing here. We're the same strategy, same goal, is have a gap between the number of people that need critical care and our capacity to deliver it. But in North Dakota, we think we can get there with the current approach that we have. But again, we'll monitor that on a day-by-day basis. If our current approach is not working, then we may need to provide stronger guidance. Jacob?
If I may trail off of that question, then with cities like Grand Forks and Fargo right on that border, how do you recommend, well, I guess, how do you see people being affected by our neighbors enacting that policy, and any recommendations on how our friends on this side of the border should interact?
Question from KFYR is when we've got border cities like Fargo and Grand Forks right on the Minnesota border, what recommendations or how should people act? And I would say, again, the goals are the same. I mean, Minnesota wants to stop and slow the spread. North Dakota wants to stop and slow the spread. I think that if you're I'm going to say North Dakota is works for our culture, our government, our everything we have. I think I've got empathy for any governor in the state that's got a majority of their population in one large metro area, and then lots of rural areas that kind of look like North Dakota. It's hard to do anything other than statewide orders. But I mean, you take a look at a lot of, pick Nebraska with Omaha, pick Illinois with Chicago, pick Kansas and Missouri with Kansas City. I mean, you end up with states that have a lot of rural and some really huge metro areas. Makes it difficult doing. I know that people have tried in other states to say, hey, this order only applies to a metro area. Guess what people do? Everybody goes and heads to the bar and restaurant that's 10 miles outside the order limit. Everybody goes to the other side, and so I can understand why other governors are having to make what are probably look like tough calls in the rural areas to try to protect the majority of the people in their metros. But I would think that the guidance that we've given for our state of North Dakota, it works for Fargo, it works for Grand Forks, it works for Wahpeton, and again, it's keep physical distance, and if you're sick, stay home. If you're with somebody who is undergoing testing, and you've been around someone who thought they were sick enough to get tested, you should act like you're positive, just like they should act like they're positive until you learn differently. Those are the folks that really need to not just self-isolate. They need to essentially quarantine themselves and quarantine yourself for 14 days if you're in that case, because those are the individuals that can really help us slow the spread.
Section of the public that's in favor of trying to sort of reopen the economy within a couple of weeks now. To those people, how would you justify closing bars, restaurants, movie theaters, places where there are public gatherings? Is there a way to quantify the progress that we've made by doing that?
Jeremy Turley, Forum News Services, suggesting that there is a set of people that want to try to open things up and get the economy going, and then how do we justify it for the folks that are that have had to close down. Let me take the first question. In terms of how we quantify it, I think we're really taking a look at are we slowing the spread? Unfortunately, we can't run a parallel universe to actually find out what would have happened if we had done nothing. The best we have is models, and we can look at other places that were slow to act, like Italy, and we can look at places that acted quickly with massive amounts of testing, like South Korea, and you can see very different results. I mean, you can even see a different result in China. People have made statements that China didn't act fast enough, but when they did, they really locked it down. And you're talking about only 2,000 deaths in an area that's got 60 million people in that core part of China. and both Spain and Italy have already blown past it. So I mean, I think we don't have to study history. This has all happened since February 1st. I mean, or January 1 in the case of China. I mean, we can look at very recent examples, and I have more confidence from some sources we talked to that the data from China is actually accurate. And so then we've got some real examples we can look at and say, here's what works and what doesn't work. And when you don't have a vaccine, you don't have therapeutics, and you got a highly contagious virus, the only way you can stop the spread, because it wants to jump between humans, is to keep that physical distance between humans. I mean, that's what we're doing. So we would certainly think that not only what we're doing here, but perhaps what has gone on. I mean, take a look at any of the data. Airline boardings in North Dakota has gone on the scale in terms of our people practicing social distancing. So you have to say that it is slowing the spread versus the do nothing model. Now, what do we do to help support people who made the decisions either courageously on their own or were part of a group that were, that under mandated closings under the emergency order? That's where all the economic crisis that is a output of solving the global health crisis. There's an economic crisis, and again, that's where a lot of that has to come from. And you're going to see both federal and state support coming in on the backside of that. So what we say to them is, let's get this bill that's passed the Senate last night. Let's get this thing through and passed. Lots of money in there for small businesses. Pleased to see that the amount, at least that came out of the Senate. We talked here about state grants. Block grants was $10 billion. It's now at $100 billion. It looks like the piece for North Dakota might be more than $1 billion if that survives. And then, we would be in a position to use that money to fight the fight. And if we couldn't use it directly for economic support, it would at least free up resources for us to be able to do that. And as we said, we've got great tools, Bank of North Dakota and the Commerce Department leading the charge on what we can do to help get our economy going again when we come out the backside. Wayne,
Governor,
KX News.
Governor, I had a viewer get in contact with me earlier today, and they wanted to know two things about the hospitalizations. The first one, I'm sure I probably could have answered with a no, but they want to know if you can say what cities that these people are located in.
Question is, can we say what cities are the people hospitalized in? And the answer is no.
The second one being, what qualifies them to be in the hospital, and are they using respirators?
Next question is, what qualifies them to be in the hospital, and are they using respirators? The first part of that question, because that was a two-part question, the first one is that's up to the medical provider, and I'm sure it's like any other decision the medical provider is making, which is if someone is not recovering at home like you would from the flu, if you would see those symptoms, particularly in terms of whether it's the, coughing and shortness of breath, temperature, if those things are unresolved and escalating, and it also depends on what the person's underlying age and health conditions are, whether they're more at risk, then the health providers, I'm sure, in our state are making judicious decisions about when it's time to move somebody into the hospital and give them additional care. And then the last part of, are they on a respirator, on a ventilator? Don't know that, and if we did, we wouldn't release it.
Governor, you mentioned a few days ago that most of the unemployment claims over the weekend were coming from the energy sector. Do you have any indication that that's shifting at all?
Question again from Jeremy at Forum News was earlier, as we had reported up through Sunday, virtually every one of those unemployment claims was related to energy industry, and he was asking if some of the new claims this week were shifting to other industries. I don't have that breakout in the briefing that I have, but I got Brian Clipful from Job Service. Brian, you want to come up here if you know the answer, and if you don't know the answer, come on up and say hi. Here's Brian, who's doing double duty. He's been a long time fabulous state employee, former colonel of the North Dakota Highway Patrol, and then he had a second career as head of Workforce Safety Insurance. And then now we've asked him a few months ago to do double duty, so he's running Workforce Safety Insurance, the statewide insurance program, and he's also running job service at a time when we asked him to take on both those jobs. We didn't tell him we were going to have an explosion in unemployment, but we're glad he's there. And so here's Brian Klipfel.
Thank you, Governor. Answer your question, we are starting to get some data together on that, and there is more people coming in from the hospitality industry right now, and we still have oil and so forth coming in, so the numbers are increasing. I don't have an exact number for you, but we do know that those numbers are increasing.
Stick around nearby, within 2 meters. Stick around, or away more than 2 meters, but stick around. One thing, again, we'll have more details when the federal package gets through. But one of the things that's still alive and being discussed is a substantial increase. More than hundreds of billions of dollars going into unemployment insurance is one of the things that Lieutenant Governor Sanford and I had been advocating for into that system. But that may come not only shoring it up, but it might actually increase the amount of payments that people are getting. In some proposals, it's double what they would have been getting under state employment. There'd be a federal component that could double it. And so I would, I'm optimistic that for those people that have been temporarily displaced from work are going to have the potential for better benefits than we've ever seen, and that's a good thing for those families and good thing for the economy when we're coming out the backside. But we'll see how that all sorts out. Other questions?
Governor, you've been pushing the concept of individualistic responsibility, but let's say someone has a confirmed case of coronavirus and they go around about their business, go shopping, do what they need to do. Is there a policy of possibly punishing people for breaching a quarantine, or have you considered creating a punishment?
Question from Jacob is, we've been talking a lot about individual responsibility, but if we had someone that had a confirmed case and they were acting irresponsibly, still going about doing their business, whatever, sort of what mechanisms would we have to control that? There is an existing law and existing capability with our state health officer has the ability to issue quarantine orders for individuals who might not be complying, and will be I know that we'll be willing to exercise that, and that our state health officer will be willing to exercise that, of course, using judiciously and with common sense, because we got to balance personal liberty, but we also have to make sure that if we have individuals that are that have the potential to literally spread a disease that could kill other people, then we want to do that and put those restrictions and quarantine orders in place, and then when they are in place, then it's back to local public health officials and local law enforcement to be in making sure that there's compliance with those orders, and those orders would generally be quarantine stay-at-home orders would be the basic thing, which is just you got to stay home.
Based on the grammar, have any quarantine orders been put in place?
There is one that's been signed but not served.
What does that mean?
It means that the individual may or may not have been informed that the quarantine order has been put in place.
How long does it normally take for someone to be informed?
As long as it would take local officials. That individual, think of it like serving a warrant at a house.
Governor, I was just wondering if you might have an update on the 270 pending cases from the private lab. I believe it's in California.
From the Quest lab. I saw that information earlier today at 3 o'clock, and I believe that it's about 225 still pending out of that batch. 219? Okay, I was close. Thank you.
One a little bit off the subject, not off the subject itself, but there's only been one case that has been reported in somebody under the age of 20, correct? Has there been any consideration to go back and say, high schools, you could do your spring activities again. Would you consider that, without crowds, or is it just still prudent to have that prohibition still in place?
Question from Dave Thompson was, since we've only got one case under age 20, would we think about resuming high school activities or other high school things this spring? The challenge with the good news about this pandemic is that it is sparing our young people. Unlike polio, unlike smallpox, unlike the pandemic, the flu, 1918, where it took, healthy people of all ages. This is, one of the blessings if you're young. Not a blessing if you're over age 65 or have underlying health conditions, but at least for parents that, and as a parent, know how much we all worry about our children, it's a blessing that there's maybe less anxiety because we don't have to worry about that. When you put our 113,000 kids in our K-12 public school system back in buildings, there are people that are, of the age group or of vulnerable or whatever. So again, during this time, we are, proceeding as we've said to, get classes online or alternative learning, distance learning, all the different programs, those plans keep pouring in from K-12. I think you've probably seen reports locally, but some of the private sector high schools in our state, like Oak Grove and Fargo or Shiloh here, I think Shiloh's back online today. Oak Grove got back online yesterday. Say online, but they're rolling out a week ahead of the public system how they're going to do their distance learning, where kids can keep learning when they're at home. But Dave, we'll keep monitoring this, but if it was just high school kids, maybe, but it's very few times you get high school kids without other vulnerable adults that are in the mix. And if you look out, today we're nearing the end of March, is it possible 2 months from now, end of May, that, could you have a state track meet 2 months from now? I suppose. Is it likely? I'm not sure, because again, it'll depend a little bit on how our curve comes and when it comes and what the risks are. But if we can also invent activities that allow people to keep a distance from each other, maybe there'll be entire new sports that are invented.
Let the record reflect that a 62-year-old lifelong bachelor asked that question.
Okay. Okay, Lane? Or before Lane, I got one coming in from online.
Eric Arndt with KZZY in Devil's Lake asked, with confirmed cases in more rural areas of our state, how are we supplementing and supporting our rural healthcare providers?
From Eric Arndt in Devil's Lake, with some cases showing up from the rural areas, what are we doing to support those? Again, we have to protect personal information, but I would say, again, what we're learning from people volunteering information, that some of the cases that may showing up in a rural county, they may have gotten tested at a larger metro city location. So, tests might have occurred in Grand Forks or Fargo or Bismarck or Minot, and that individual is in the care of that system, which may mean that they could be getting cared for in a city, or they could be, quarantined at home. Right now, we're continuing to build the plans for what we call rapid response. If we had a more severe outbreak of COVID in a rural area, a rural nursing home, in a tribal area, that we'd be in a position to respond. So that's one of the scenarios we're actively working on. But right now, with the number of cases and with the capacity of the current healthcare system, those are being managed well today within the system without additional support from the state. So so far so good, but we're keeping a close watch on that, and that's why we're pulling together this private-public partnership on testing and private-public partnership on hospital surge capacity, because we've got to work, as the state of North Dakota with the private sector to make sure we've got the ability to flex up on both of those. Okay, back to you, Lane.
Governor, you've got plenty to deal with when there's not a pandemic. Now with all this extra stuff, how are you doing?
So Lane says, I got plenty to deal with when we're not dealing with pandemics, how I'm doing. Well, I appreciate the personal question, but happy to report that I'm doing great. The First Lady's doing great. We're trying to practice all of the keep physical distance, guidance that we're giving to everybody else, and she's great to hang out with. And so I've seen her more than I have probably since we've been elected. So that's been great. That's a big positive from my standpoint. I'll have to ask her separately how she feels about that. But I think it's fantastic. And then in terms of the other sort of cogs of government, again, we held our first North Dakota Industrial Commission meeting yesterday with the Attorney General and the Ag Commissioner. We were all in a big room sitting a long ways apart from each other with microphones, and staff was, normally those meetings are packed, and everybody that presented, whether it was from the EERC up at UND, the Energy and Environmental Research Center, or Department of Minerals, whoever was presenting was Skyping or Zooming into the meeting or dialing into the meeting. North Dakota Finance, Bank of North Dakota, Public, whatever. I mean, so we dealt with half a dozen agencies yesterday, did it all remotely, and we made motions and conducted a full meeting and got it done. And it's a switch when you're used to doing stuff in person across the table. But I'd say again, a shout out to the Industrial Commission team and the North Dakota IT team and everybody that's making it possible for us to continue to do a lot of great work for North Dakota. And so keeping the wheels of government going.
One more for you. This might be a question better suited for somebody in the Department of Health, but I wanted to ask you about a change in the counting of the cases on the website. There's now a category called isolation discontinued. I'm sort of interpreting that as recovered, somebody who had tested positive that is now recovered, and then the category for pending cases is now gone. I'm just wondering if you could take us through why that was done.
Couple of questions on testing, and I'm looking around, phone a friend, very detailed from Jeremy about changing of labeling on the website about pending cases and or another category called isolated. Yeah. Is there anybody, Mylyn, do you want to, if you've got, if not, Jeremy, we can get back to you if we don't have that information.
We're making some changes on the website so that we can be accurate about what we're showing, and we know that there are people that were under monitoring that have been through that 14-day quarantine and have been released from monitoring. So that's that one column that you're talking about, or that bubble around isolation release. The second thing around pending tests, the access to testing is improving all the time, and so there are tests that are going out to other locations and reference labs, and at the time we don't have visibility to that, so we want to be accurate about what we can show.
Okay, just one follow-up there, sorry. So with isolation discontinued, that doesn't necessarily mean somebody who had tested positive. It just means somebody who the department was monitoring that is no longer quarantined.
Yeah, I think in the future you will see a recovered category, and we will show that when we have that.
Thanks, Mylyn. It's our state health officer. Other questions? Okay. Hearing no more questions, again, in closing, just want to again thank everybody who's listening in and give a shout out to all the people that are doing great work to help us flatten the curve, and all the folks that are working in healthcare to help us, get that line higher. Let's keep a distance between two of those. And like I said, we're in the early parts of this. We can look to other places in the world to see where they're at in their battles. We're in the early days, and we are happy to take advantage of these. I used an example earlier today, which I'll maybe share now, but it has to do with sandbagging. One of the things we know about in North Dakota when we have emergencies that come in the spring related to flooding, whether it's Fargo, whether it's Grand Forks, whether it's Minot, whether it's many other communities, we have a lot of people who've got a lot of experience with flooding examples. And what we are, when we see the flood report, and then we anxiously await for the next flood report. What's the flood prediction going to be? How high is it going to be? Oh, the flood's going to be worse. We need to sandbag. We need to sandbag higher. We know that there have been times where if you don't start building the foundation strong enough on your sandbag wall, that if the forecast